Hello everyone and welcome to another anatomy video. This is Dr. Ayan from the Veterinary Anatomy channel. Today we will talk about the anatomy of the thorax and specifically the circulatory system. So we will talk about the heart and the main arteries arising from the heart of the dog. So let's get started. So here, as you can see, the heart is located inside this sac here. I will move it a little bit like this. So this is what's called the pericardium, from the name, pericardium. So something surrounds the heart, pericardium. So this is the pericardium, this sac. As you can see, it starts from the base of the heart, from the beginning of the big arteries, and surrounds the heart completely. This pericardium could be divided into two parts. I will cut it in the middle. If you allow me, I'll just cut it in the middle like this, without cutting the phrenic nerve there, which moves inside the fibrous pericardium. So the pericardium has two layers. The fibrous pericardium, which is located superficially here, and the serous pericardium, which is located deeply there. The serous pericardium is also further divided into the parietal serous pericardium, which covers the fibrous pericardium from inside, and the visceral pericardium, which located or covers the heart directly and called the epicardium. Here, let me just tell you that the heart and the pericardium are fixed in their place by what's called the ligament. Here in the dog, we have two ligaments, while in other animals, there's just one. In the dog, there is a ligament here. Look at this ligament, extends between the pericardium and the sternum. The sternopericardiac ligament. The sternopericardiac ligament here. This is something we can find in all animals, including dog. But in the dog, there is an additional ligament extend between the pericardium and the diaphragm. This ligament here, this ligament. This is the phreno-pericardiac ligament, phrenic from diaphragm. This ligament here, they are there to fix the pericardium in its place. Let me dissect more and we will come back. So in this case, you may ask yourself, what is this red structure there? Let me just tell you, this is not normal, of course. As I mentioned, we injected the arteries with rubbers to make it easier for dissection and for to let you see these arteries. As you can see, they are completely filled with rubber. And somehow there was a small rupture in the wall of the atrium, left atrium, and the rubber moves from the atrium or from the heart into the space which is located between the pericardium and the heart itself. Pericardium and the heart. This space called the pericardial space, which is normally filled with some fluid to reduce the friction between the heart and the surrounding structures. Okay? This space, and because of the injection, is filled completely with this fluid or with this rubber. And now we will try to take this not normal rubber from this area here to show you exactly what we mean. Now, look. So, this is not normal, guys, but it's good that this happens just to tell you that this is the space. This is the space. Now we can see the space between the heart and the pericardium, the pericardial space. Because of this rupture, this space was filled with rubber while injecting. And look, so the space is really huge, you know, is filled with some fluid, not the same amount of the rubber, with some fluid to reduce the friction between the heart and the surrounding structure while the heart is pumping or moving. Again, let me now tell you again something about the pericardium, which we just cut here in this area. The pericardium has two parts or two layers. From outside here, we have the fibrous pericardium. From inside, we have the serous pericardium. The serous pericardium has also two layers. The parietal layer, which covers the sac from inside, this one here, the parietal layer of the serous pericardium, and the visceral layer of the serous pericardium, which is located directly on the muscle of the heart. And that's why we can give it, the visceral layer of the serous pericardium, give it another name called the epicardium. This shiny layer on the myocardium, on the heart itself. Okay, pericardium, it forms this sac, you know, which surround the heart, as you can see. Between the parietal layer and the visceral layer of the serous pericardium, we have this cavity called the pericardial cavity, filled with some fluid called the pericardial fluid to reduce the friction between the heart and the surrounding structure. Here we will start by describing the structures which we can see, structures of the circulatory system which we can see inside the thorax cavity. Just for your orientation, here in this dog, we removed the forelimb, both sides, of course, and we removed, as you can see, most of the ribs. We keep just the first rib here and the last 2-3 ribs there because they are somehow attached to this structure, which is actually the diaphragm. Good. Here we can ventrally see the sternum. This is the sternum. Dorsally, we have the spine with the spinal muscles. In this case here, we removed also the left and the right lungs so that we can see just, the heart and the main arteries going out of the heart, from the heart. I would like also to mention that I removed all connective tissue, which we can see here, to be able to see all other structures inside the thorax. Good. Let's start with the heart. The heart, this organ, is located inside the thorax cavity, approximately between the 3rd to the 6th intercostal space. In general, we can describe the heart as it has like a base. This is the base of the heart here and apex. The heart itself has 4 chambers, 2 ventricles, 2 atria. The heart has also 2 faces. The one which we can see in the left view here called the auricular face, or the left face of the heart. The other side or the other face called the right face or the atrial face. And the reason why we name the left face of the heart as auricular face is because these 2 structures which we can see here and there, which are the auricular cordis. The auricular cordis is somehow like an extension from the atrium, left and the right atrium. In this view, in the left view, we can see normally both auricular. This is the left auricular cordis, And on the other side, we can see the right auricular. Normally, both of them are, we can see them in the left view. The right auricular is not filled in this case with rubber. So this auricular is bigger in this case because we injected the arteries, as you can see, with rubber to make everything clear. Again, the heart has auricular surface, and on the other side we have the arterial surface. We will look at it later. The heart has also a cranial border and caudal border. As we mentioned, here we have the two ventricles. The caudal located one in the left view or in the right view is the left ventricle. So this is the left ventricle. The left ventricle comparing to the right ventricle here. This is the right ventricle. The left ventricle reach the apex, as you can see, while the right ventricle ends somehow here in this area. In the auricular face or in the left view here, we can see one groove superficially here between the right and the left ventricle called the paraconal interventricular groove, in which we can see one artery called also the paraconal interventricular artery. On the other side, of course, we have another groove called the subsinosal interventricular groove, so we will talk about it later. So two ventricles, the left ventricle and the right ventricle. We have also two atria. Atria is plural of atrium. So we have the left atrium here under these veins here. We have the left atrium, and on the other side here we have the right atrium. From the left atrium, as I described, here we have this extension called the left auricular cordus. Good. Let's move now and talk about the main arteries arise from the heart. And let's start with the pulmonary trunk. This big artery, let me just move the nerve to the side here. There is a big artery here, arises from the right ventricle, called this one here. I will show you. This is the pulmonary trunk. So this one here is the pulmonary trunk. If you follow it, you will find that the pulmonary trunk arises from the right ventricle. Transport the blood from the right ventricle to the lungs. So that means if you follow the pulmonary trunk, at this level somehow it gives two big arteries. Here we're talking about the pulmonary arteries, the right and the left pulmonary artery to the right and to the left lung. So the pulmonary trunk from the right ventricle. Another big artery arises from the left ventricle, deeply there, and this is what I'm talking about here. This is the aorta. So the aorta arises from the left ventricle. Before we talk about the main branches of the aorta, let me just tell you that at this level here, you can find a ligament, which I'm holding here, a ligament which extends between the aorta and the pulmonary trunk, called the ligamentum arteriosum or Botalles ligament at this level here. So this ligament was a duct before birth. Of course, at the birth time, this duct will be closed. The reason for this duct, of course, before birth, the lungs are not functional, and that's why the heart doesn't need to send the blood through the pulmonary trunk to the lung for gas exchange. And the blood leave, in this case, the right ventricle to the pulmonary trunk, and through this duct directly to the aorta, and after that to the body. So the aorta arises from the left ventricle exactly at the level of the beginning of the aorta. It gives two arteries. Here we are talking about the coronary arteries, the left and the right coronary arteries, for to supply the heart with blood. Coronary arteries. The coronary arteries moves exactly inside what's called the coronary groove, which we can find at the base of the heart, just between the ventricles and the atria. The coronary grooves. The coronary groove. The aorta, from here up to the diaphragm there, could be divided into what's called here the aortic arch. This is the aortic arch. And from here backward, we can name this part of the aorta thoracic aorta. And after the aorta penetrates, the diaphragm inside the abdomen, called the abdominal aorta. So again, that means the first two branches from the aorta are the coronary arteries for the heart itself. After that, the aorta moves, as you can see here, forms what's called the aortic arch, and gives at this level here a very big artery, this one here, called the brachiocephalic trunk. So this one here is the brachiocephalic trunk. And from the name, brachium, that means forelimb, cephalic, head, that means this artery is responsible to supply the forelimbs and the neck and head. Brachiocephalic trunk. We will talk about the branches of the brachiocephalic trunk later. After the brachiocephalic trunk and directly from the aortic arch, here we have another artery called the left subclavian artery. So the left subclavian artery originates or arises from the aorta directly in the carnivores. If you want to compare this one with other animals, let me just tell you that it comes also directly from the aorta in the pig, cat, camel, but not in ox and equine. In ruminants and equine, the left subclavian artery originates from the brachiocephalic trunk, so not directly from the aorta. Here, so the left subclavian artery originates from the aorta, while the right subclavian artery, which I will show you later, originates from the brachiocephalic trunk. Here, let's continue. Backward here, you will find that from the thoracic aorta, here we have a segmental branches, which moves upward and moves after that between the ribs. This is the segmental branches from the aorta. So we talked about the pulmonary trunk, we talked about the aorta. Let's finish the structures related to the heart before going to the final branches there. Here, as we mentioned, we have, this is the area of the left atrium. To the left atrium, of course, we can find all of these small, or they are not small actually, veins, pulmonary veins. All of these veins comes from the lung, carrying oxygenated blood to the left atrium. After that, the oxygenated blood will move from the left atrium to the left ventricle, and from there to the aorta, to the rest of the body. Good. Now let's move and talk about the branches of the brachiocephalic trunk. If we move, this is the first rib, just like for your orientation. if we want to see the final branches. So let's move it to the side like this. And now I will move also this nerve. Let me just tell you that this is the phrenic nerve. So on the base of the heart, you will find actually two nerves. Just for your information, this is the phrenic nerve, because if you follow the phrenic nerve, you will find that it will go directly to the diaphragm and innervate it. So if you allow me, it comes actually from the cervical spinal nerves there. If you allow me, I will just move it and reflect it, put it here on the diaphragm. The other nerve which we can see directly on the here in this area is the vagus nerve, and we will talk about the branches of the vagus nerve at the end of this video. So let's now continue with the brachiocephalic trunk. The brachiocephalic trunk arises again from the aorta or the aortic arch and moves forward. Here, if we move the left subclavian artery to the side a little bit like this, you will find that from the brachiocephalic trunk, this is the brachiocephalic trunk, it gives a big artery to the right side, that one here, called the right subclavian artery, and another big arteries here and there are the common carotid arteries, which we can find in the cervical region here, deeper between the muscles. Again, the brachiocephalic trunk originates or arises from the aortic arch. In the dog, it doesn't give the left subclavian artery, because the left subclavian artery comes directly from the aorta. So let's stay with the brachiocephalic trunk. It gives here 1, 2 common carotid arteries, which moves directly forward to the neck area and finally to the head and to the right side. And I will show you this artery also once we rotate the animal. This is here the right subclavian artery from the brachiocephalic trunk. So this is the branches of the brachiocephalic trunk. Let's put it again and move to the left subclavian artery. The left subclavian artery in carnivores again originates from the aorta and gives here at this level, firstly, this artery, which is the vertebral artery. If you follow the vertebral artery, it will move directly here between the muscles and enter the transverse foramens of the cervical vertebra and moves along with the vertebral nerve and vertebral vein inside the transverse canal of the cervical vertebra. So the first branch is the vertebral artery from the subclavian, left subclavian artery. The next branch, if you look at it, it moves upward. This is the costocervical trunk. The costocervical trunk gives here, as you can see, 2 branches. The first one moves deeper here between the muscles of the neck, and that's why we will name it as deep cervical artery. And the other one moves toward the ribs, and that's why the main artery here called the costocervical trunk from the left subclavian artery. After that, from the left subclavian artery, another artery moves backward and ventrally here, called the internal thoracic artery. The internal thoracic artery moves down and backward and moves on the dorsal surface of the sternum. This is the internal thoracic artery. If you follow this artery, you will find that at the end, it gives some blood supply to the diaphragm in this region, and it leaves the thoracic cavity as a cranial epigastric artery, which we can see just under the skin in the abdominal region. which is responsible in females for the blood supply of the cranial mammary complexes. Again, this is the internal thoracic artery. The next artery from the left subclavian artery is the superficial cervical artery. This is the superficial cervical artery. It moves from the name superficially here for the neck. And let me just tell you that after giving the superficial cervical artery, the left subclavian artery moves away from, or moves out of the thorax cavity, gives one branch here called the external thoracic artery, and moves toward the forelimb, and at that level it's called the axillary artery. Okay, so quickly we have the left subclavian artery. It gives the vertebral artery. It gives the costocervical trunk, which will be divided into two parts, the deep cervical artery and the costal branch. So here we have the internal thoracic artery, we have the superficial cervical artery, and after leaving the thorax cavity in front of the first rib, it gives another branch called the external thoracic artery, and after that moves toward the forelimb as axillary artery. So this is the main branches which we can see here. So if you allow me, I will just introduce some other structures which we can see in this view. For example, here we can see the cranial vena cava. This is the cranial vena cava, which will be formed by the two external jugular arteries, jugular veins. So the cranial vena cava, which will be formed by the two external jugular veins, which we can see here under the skin in the neck area. So we have this here, the left external jugular vein. Here we have the right external jugular vein. From, of course, the forelimbs, we have another veins coming and join the external jugular vein, and finally to form the cranial vena cava. It's better to look at this structure in the right aspect, or in the right view. So let me move or rotate the animal so that we can see the right view. Here again we can see the phrenic nerve, which is responsible for the innervation of the diaphragm. We can see here the esophagus, which we can follow here. This is the esophagus located dorsal to the trachea. There is the trachea. I will show you this in the right view. And finally we have the esophagus also here.